capacity advancement program, I am extremely proud of having teams led by Russia really making a huge impact into creating so much awareness on how do we deal more effectively with these diseases, how do we early diagnose these patients, how do we educate on quality of life, lifestyle, and all this kind of, well, obviously diet, exercise, and healthy living. This has been very, very, very important in engaging with multiple stakeholders, creating and shaping policies that will have, I believe, a major impact in the future. Our capacity advancement program goes, as I said, beyond awareness. We focus very much on those areas which are really hit by these devastating diseases, and we educate and try to create capabilities by providing long-term partnership with African universities to educate physicians or students, medical students and pharmacists, which are going to be the new healthcare professionals, to better deal with these diseases. And we have done that in more than 7 countries, starting in 2012, as Rasha mentioned, and our commitment is to reach 25,000 students by 2018 to better address these global health issues that are so worrying.
And ever since I have been involved in Merck Capacity Advancement Program back in 2012 in Darmstadt, Germany, I could see the potential of this program to improve diabetes care in our continent. And thanks to the incredible energy of Russia and her team, and thanks to the support of Merck, because chairman of Merck, Dr. Frank Haberkamp, visited our continent, visited my country and other African countries. This shows the commitment of Merck for Africa continent. And what we're involved in Merck Capacity Advancement Program is to train our students and undergraduate and postgraduate students on diabetes and other non-communicable diseases, because these are the healthcare professionals that are going to be deployed to the rural areas, where the first visit for our patients would be in those areas. So I think we are going to continue working with Merck in this capacity, and thank you all for involving us and leading the way. And this is a perfect example of public-private partnership in which Merck has really taken the lead in bringing us together, ministries of health, civic societies like diabetes associations, and medical universities.
Indonesia actually sharing the same experience like in the African continent also. So we are now undergoing the transitional epidemic from communicable to non-communicable disease, which still have the largest burden on the like tuberculosis, HIV, and also now moving towards the NCD, in particular for diabetes also. And we experience also the multiple burden of nutritional problem, from stunting, malnutrition, and also now obesity is increasing very rapidly. The prevalence of diabetes in Indonesia is very rapidly increasing from 5.7 in 2007 to 6.9 in 2013, with the amount of almost 10 million of people affected by diabetes. And according to IDF, ACLAS 2015, we are the 7th largest affected country on diabetes in the world.
Yes, diabetes is a huge epidemic here in the UAE. We're not different than the rest of the world. We're actually a bit unlucky because despite the young age of our country, we have one of the highest prevalence of diabetes. It's at 19%, which is quite not good. As far as the Merck Capacity Advancement Program, I thought it was a great idea because Merck helped us create this wonderful day-long program where we arranged for different diabetes education material using our expert local faculty who are familiar with the disease in our area, and then also benefited from having experts from the UK join us on the day. It was successful feedback from the students who are the end users. It was open to students from our university, but also universities in the UAE at large. And I thought it summed up A to Z about diabetes and all the advancement in the field.
Actually, when we started this program, and when we talk about diabetes, as you know, it is an epidemic worldwide, and the many figures mentioned by all my colleagues, I just would like to give the picture of how many diabetics we have in Dubai. We have around 700,000 diabetic in Emirates, and around 940,000 who are pre-diabetic. So we have a huge problem. And from the e-claim data where we insurance is there, we have around 213,000 diabetic only in Dubai, out of 2.4 million insured population. So we have a high volume, high frequency problem. Dealing with diabetes is different than dealing with acute disease. If you treat a chronic problem, the best example, which is adopted by many countries and well known to give the best results, is the chronic care model.
So I think this is a laudable thing that hypertension has been brought on board, partly because, of course, as you know, at least 2/3 of people with diabetes have got hypertension. So you really can't manage diabetes without managing hypertension. And we also know that in terms of interventions, probably one of the most important interventions you can do in a diabetic is to treat their hypertension. And of course, hypertension, as has already been said, is a major cause of morbidity and mortality worldwide, and particularly in Africa.
Now we will come to the main occasion of this event, is to kick off the Merck Diabetes Award and Merck Hypertension Award. Before we do this, we want to expand these awards to all, most of the countries in Africa and Asia with our partners universities. And we kicked off this for the first time in UAE with Dubai Dubai Medical University. It was only the Diabetes Award, and the response and the amount of concept papers, because the idea is the students have to provide concept papers submitted, how to improve awareness about diabetes in their country. So think out of the box, be innovative, new policies, new ideas, new programs, whatever, and then there is a scientific committee will screen these concept papers and choose the winner. The winner will be one winner from each country, one for diabetes, one for hypertension, because the same award will be also for hypertension, and the winner will have the diploma, postgraduate diploma of diabetes or preventive cardiovascular medicines in case of hypertension. So, of course, by doing that, it's a postgraduate diploma 1 year. By doing that online, of course, by doing this, we create a platform of diabetes and hypertension experts across Africa, Asia, and Middle East, and the developing countries. The winner, of course, you will assume there's two winners actually. The scientific committee decided to split the prize between, or the winning between two concept papers. The first winner, we will announce it at the end, and now the winner of the social media, the Diabetes Social Center, which is concept paper developed by Sana Larib and Zofia Fatima.
Thank you, Rasha. I also would like to echo your congratulations. I actually like your initiative, and I think as being together in Dubai, I think yes, what is important. We have the ladies and I think we will provide the support. Our team is here. We will definitely help you to develop the concept of diabetes.
Well, I'm so excited for the winners. Like Rasha was saying, actually all the concept papers were great. It was very hard to choose from them. I'm glad that there was a whole scientific committee that was involved in this. People were not from the medical college, so there was no conflict. But yes, I think this is a great idea. Working at the Diabetes Center, I can see how this can evolve actually. And I'm so glad that we will get the support that we needed and see those young girls put to work. So thanks.
The idea, the second idea or the first idea who won the votes of the scientific committee was the blood sugar level card, which is updated every 6 months, and without it you cannot have the government service. And this is a very good idea to enforce, actually, because now we are talking about lifestyles, but we go out and eat hamburger and Pepsi and all this. So now we enforce actually the diabetes guidelines. So I would like to welcome the first winner is Nujud Shirawi. Please come to the stage. Nujud Shirawi. She will have the postgraduate diabetes diploma from South Wales University. It's online diploma, and I wish you very good success, and I wish you all the success and happiness and everything. Thank you very much for this.
Rasha, the idea is interesting. The development, of course, followed up. So again, we'll try to help. It's going to be a bit more complicated than the previous one, but we will definitely try to do it.
you.